Okay, 12.5 health issues related to the human nervous system. Nervous system disease. We should be thankful for having a central nervous system that functions well. However, the central nervous system can become damaged and stop functioning efficiently. A few examples of health issues related to the nervous system are given below. Okay, so I will explain this using a PowerPoint. So we start with this first. Okay, epilepsy. Okay, epilepsy, the occurrence of abnormal activities in certain parts of the brain causing the nerve cell to produce unusual signals. A person suffering from epilepsy may become unconscious and experience muscle spasms. So, muscle spasms, in the simple words, mean uncontrolled contract of muscles. Okay, you feel pain lah. A bit like a muscle cramp. Okay, muscle cramp that will occur lah during this epilepsy. So I try to find the words in the Chinese. There's this one. Maybe you can Google lah. Okay, and then this one the cause. Okay, epilepsy because of the brain central nervous system in which brain activity becomes abnormal. So symptoms, temporary confusion. You can see a staring spell. This one when this occur, the person will keep on staring. So when you call him, he will not respond to you like that. Muscle stiffness means cannot move. Okay, not easy to move lah. Actually, the stiffness difficult to move. Your muscle difficult to move. Loss of consciousness, uncontrollable movement, tongue bite. So this one tongue bite. Okay, the person will bite his own tongue lah. Okay, but if you put your hand at this person he will also bite your hand, your fingers maybe until bleeding. Okay, and then loss of bladder or bowel control. This one related to the defecation lah. So risk factor you can read here. Family history, getting older, infection, seizures in childhood. Means during baby also the person during baby also loss of consciousness. Maybe she also suffering from a staring spell from the childhood. Okay, and then also head injuries. So this is the first disease lah. Okay, epilepsy. Okay, abnormal activities of certain parts of the brain causing the nerve cells to produce unusual signals. Okay, and then next we have the brain paralysis or cerebral palsy. Okay, brain paralysis occurs because of brain damage before or after a baby is born. Okay, before or after a baby is born. Maybe this one before, maybe inside the mother womb lah during pregnancy. Okay, it could also possibly occur in children between the ages of 3 to 5 years old. So this means this brain paralysis will occur during during when the person in the childhood. Okay, okay. This disease causes failure in muscles and the ability of motor neurons to function properly. So motor neuron not function properly. Okay, this example lah. Okay, this one may be a type of the paralysis. Okay, so just for your information lah. So arm and leg of one side. So this one maybe you can see the characteristic here lah. So if you see this characteristic like this, so that means this person suffer from brain paralysis. So if just one side, maybe like this the arm, okay, and then she walk like this, okay. This one type of brain paralysis. So this means these girls suffer from brain paralysis lah. So this one both legs, maybe the legs look like this, like a band, okay. Body should be normal or with very minor signs, but the ankles and feet will be bend like this. This one means both legs lah. Okay, and this one for the both arm and both legs. So you can see the appearance of the person like this. So he walks his arm like this lah. May twist strangely. Okay, 4 limbs affected. So because of the severe brain damage. Okay, so these are the appearance of the person that have this brain paralysis. So later when you see this person around you, you know lah, this is because of the brain paralysis. So we should thankful lah our brain function normally. So This one occur because of damage of brain. Okay, damage of brain lah. Before or after baby is born, or maybe between 3 to 5 years also can cause this one lah. Okay, the diseases cause the failure in muscle and ability of motor neurons to function. So just if we have 3 types of neuron, right? So if the motor neuron not function, we can get this disease lah. Okay, so this is for brain paralysis. And then we have this multiple sclerosis, a progressive disease as a result of an abnormality in the immune system that attacks the myelin sheath in the brain and the spinal cord. The damaged myelin sheath prevents the transmission of impulse from and to the brain. Okay, this one, multiple sclerosis symptoms. Okay, this one is healthy neuron. So our neuron okay, so the transmission of impulse can occur efficiently lah. Okay, from here can enter here and so on until this part, right? Okay, but for this multiple sclerosis person, they have damaged neuron. So this one exposed fiber. Maybe the impulse here will flow up like this. So not the transmission of impulse not so okay lah. Okay, because some of the impulse will flow up from the myelin sheath here. Okay, myelin sheath, damaged myelin sheath. So this one because of the damaged myelin sheath lah. Okay, prevent the transmission of impulse from and to the brain. So this is the symptom. Vision, spinal cord here will affect the spinal cord, senses, our muscle, urinary system, digestive system, mouth and brain. Okay, this one is multiple sclerosis symptom. The most important here for this topic, you must remember the cause. The cause. Okay, the damage of myelin sheath prevent the transmission of impulse from and to the brain. Okay, this one's for multiple sclerosis. Next, we have the Alzheimer disease. This one usually occur for all person lah. All people. Okay, diseases causes the loss of ability to reason and to take care of oneself. The patient is usually confused, forgetful and disoriented even in a familiar place. If the deterioration of the brain continues, the patient will lose the ability to read, write, eat, walk and talk. So this one, Alzheimer disease. Okay, so usually this one because of the loss of the ability to reason. Something okay at your brain lah. Usually at the cerebrum lah, because you have to reason and to take care, right? So memory loss, mood change, sometimes not remember the family members, not recognize the family members, not recognize the place. Okay, like that. Okay, so poor judgment. So I don't know which one to go. This one or this one. Okay, words problem. Sometimes this one lah, not able to write, to read, to write, to talk. Okay, hard to complete tasks. Okay, this one maybe for genetic, family history, age. Okay, usually all age lah, all people. Okay, we suffer this one. And then to prevent, we have to brain training, exercise, take medication. This one lah. For this one, you just remember what inside the textbook only. This one for your, this one just for your formation, to make you clear, understand. Okay, but for the question usually we ask you about this lah. Give the statement, then you have to identify the disease. Okay, for this one, Alzheimer's disease. Okay, and then next we have this Parkinson's disease. Parkinson's. It is a shrinkage of the nervous system that causes tremors. Tremors mean like shaking lah. Simple word, shaking in the limbs, jaw, foot and face. This one usually we cannot control. It will automatically occur like this. The shaking. So this one is for the Parkinson. We can see if he or she is shaking uncontrollably. Uncontrollably means one of the symptom of the Parkinson lah. The patient will also have difficulty maintaining body posture and balance. Okay. Symptoms. So this one, you can see that the symptoms. Okay. For this Parkinson disease. Okay. slowness of movement. Okay, speech changes, tremors. Tremors is shaking lah. Okay, or trembling. Flatulence means a passing gas. Like farting lah, fart. In Chinese, kalau in Malay we call kentut, right? Okay. So usually we will experience flatulence. Okay, keep on farting and so on, and then loss of smell. They cannot smell something lah. So this is the disease of the symptom, the Parkinson disease symptom. So usually we can see this one shaking for this Parkinson. Okay, because of the shrinkage of nervous system, shrink become small and something like that. Okay, so it can affect the limbs, our hands and our foot. Okay, foot and jaw, at our mouth here, at the mouth and also the face. Okay, so this one for Parkinson. Then we have next is the low grade amyotrophic lateral sclerosis, or ALS. Same lah. You can answer low grade or you can call it ALS, amyotrophic lateral sclerosis. This disease is caused by the deterioration and death of motor neurons that control the movement of muscles such as chewing, walking, and talking. This one also motor neurons, death of motor neurons. Okay, this one, symptoms of ALS: difficulty walking, trip and fall, leg weakness, slurred speech. Slurred speech means do not pronounce words. Okay, pronounce each word clearly. You cannot understand what she or he talk about. Okay, talking about clearly. This one, slurred speech. Okay, do not pronounce each words clearly. Excessive choking, maybe easy to choke lah. Okay, hand weakness, muscle cramp. So this one because of this one normal nerve. This one the normal nerve, the normal muscle, right? So healthy motor neuron. This one. So you can see affected nerve. The nerve not so healthy. So maybe a bit small here. Okay, deaf motor lah, usually motor neuron. Okay, so this one actually affected with the muscle lah. So the muscle not get enough impulse and so on. So that's why we be get this disease lah. So usually ALS patient will use this what we call a wheel. This one lah, this what's called kerusi roda. I don't remember either what in the English. Sorry okay, but this one sometimes this patient also have to use this, have to be helped by this type of lift, not as hydraulic. Okay, to make them move lah, to help them to move to other parts, to certain parts, certain place. Okay, like this. So this one is the symptom of ALS lah. Okay, or low grade, same same meaning. Okay, this one also caused by the death of motor neurons that control this one specific control the movement of muscle such as chewing, walking, and talking. So this is other symptom of the ALS. Okay, next we want to next we have this attention deficit hyperactivity disorder, or ADHD, a type of brain disease that cause someone to become hyperactive. Hyperactive means cannot stay in a place lah, keep on moving and so on, unable to concentrate and gets easily bored. This one, get easily bored. Okay, sometimes we don't know we have this disease. Okay, but usually if we can detect during small when you are small children, in the young age, so maybe it can be overcome lah. But but this disease cannot fully recovered. Okay, maybe just can control lah. Okay, so a symptom of ADHD, difficulty focusing, forgetfulness, always remain worried, easily distracted. This one, easily distracted and easily get irritated. So this one is ADHD lah. Usually these girls or boys that have this disease, they cannot stay in one place. They keep on moving, keep on doing something. Okay, cannot stay, cannot focus. Okay, this one is because the a type of brain disease affect the disease lah, affect the brain. Okay, become hyperactive, unable to concentrate, and gets easily bored. Okay, that's why sometimes the children not naughty, not naughty, but because of this disease make them like naughty boy. Okay, they cannot stay in one place, keep on touching things and so on lah. Okay, this one, the last one, we have the autism. A type of disease related to the development of nerve in the brain. This one related to the nerve in the brains. Autism causes an individual to experience problems communicating and interacting. This one difference from the ADHD. This one for autism, usually they have problems with communicating. Okay, like this. They have to spin object. Usually, usually this one can be detected at early age lah. If you have a baby, even now we have the test to test this autism, to test this ADHD at the early age. Okay, maybe if you see the development of the baby lah, the boy, like spin object. Okay, prefer to play alone. Okay, so sometimes also can be connected with the ADHD also. Hyperactivity. Sometimes there is a person or boy that have two, autism and ADHD. So this one quite what we call not dangerous, quite difficult lah for them to survive because we have autism and ADHD. But certain have ADHD only or autism only. This one all can be tested during early development of the baby lah. Okay. And then sleep problem. Sometimes they have problem with sleep. Rejecting cuddles. They don't like people to cuddle them, to hug them. Okay. And then delay speech. Usually they cannot talk. They cannot speak. They just show, when they want something, they will show by using hands. I want this, I want that, by using the fingers. Show to your mother. But he or she cannot speak. They have the delay speech development. So before the technology, we have this whatever test. So most of people don't know about this. But now this awareness about autism, about ADHD already increased. Okay, so we can detect from the young age lah. So that they can live like a normal. If they will not live like a normal lah, they will maybe near a normal person like that nah. Because actually this is autism, problems with communicating and interacting. They don't like to interact with person. Even sometimes they don't like to eye contact with other peoples. Okay, so these are example of the disease related to the nervous system. Okay, so that's all for this topic.